Hi students, today let me talk about the continuation of renal function test. Already I told you this is coming under essay question, clinical scenario case, 10 mark question, practical time you will have the practical chart, renal function test chart. So for all these questions you should know the basics of renal function test. In the first one, that is part 1, we discuss about the functions of the kidneys and the classification of the renal function test, and then clearance. What do you mean by clearance? What is the importance of clearance? What is the formula? What is the normal level, like that. Now we are going to see about glomerular permeability marker, that is marker of glomerular function. So the marker of glomerular permeability, the first and foremost important point is proteinuria. The name itself, protein present in urine. What is the normal level of protein urine in urine? Less than 150 milligram per day. Okay. Suppose the level is more than 1 gram, that is 1000 milligram, it is called as proteinuria. Right? And then some molecular weights you should know about the glomerular membrane marker, because glomerular permeability marker, because according to the molecular weight only, the glomerular basement membrane is either filtering and reabsorbing or excreting the compounds, right? They have a cutoff 11, that is 67,000. If it is 69,000, that is albumin, mean it will not be excreted, it will be reabsorbed. Whereas hemoglobin 67,000 kilodalton, which will be easily get excreted by kidneys. Next one is BJP, that is Bence-Jones proteins. Here the amount is, that is molecular weight is 24 kilodalton only. So this also easily will get excreted by kidney through glomerular basement membrane. Right. Second one is, this is the second one. Third one is, how will you classify the proteinuria? We are having 3 classifications like OGT, that is overflow proteinuria, glomerular proteinuria, tubular proteinuria. These are all the 3 classifications coming under glomerular permeability markers. The first one is glomerular protein. Here actually the glomerulus is not able to permeable to any proteins. If the level is more than 69,000 kilodalton. If it is less than, means automatically they will get excreted. The cause for this glomerular proteinuria is the loss of integrity of the basement. The basic pathology is in basement membrane only. The loss of integrity of basement membrane seen in both diabetes as well as hypertensive patients. Right? They only go for glomerular proteinuria. Okay, if the glomerular is damaged, they release the protein in urine. Normally, no protein in the urine, or otherwise less than 150 milligram of protein only, very minimally excreted. So, what happens if the glomerulus damage? They release protein in urine, means decreased GFR. That indicates glomerular filtration rate will be decreased. That leads to, that is the first sign of kidney injury. Then we have 2 conditions, that is one side is hypoalbuminemia, another side is hypoproteinemia. Both altogether forms the formation of edema, that is extravasation of fluids in the compartment. Okay, this is the third one. Fourth one is, another type of protein is overflow proteinuria. The name itself, overflow occurs in the kidney. Here the glomerular, nephron, tubules, everything will be normal, but the compound synthesis or production is very excess. So it is a small molecular weight protein. For example, Bence-Jones protein. Excess of protein in blood, they will get excreted in urine. That is overflow of this Bence-Jones proteins in tubular proteinuria. So, next example is hemoglobin. After hemolysis, there is a lot of hemoglobin in the blood that also will get excreted in urine by hemolytic diseases. Third one is myoglobin. Any crush injury, muscle injury, like that conditions, the myoglobin also will be in circulation, excess circulation, that also will get excreted in urine. So these are all the three examples for tubular proteinuria, right? Glomerular proteinuria, two examples, diabetes mellitus and hypertension because of the defect in the basement membrane, okay? Third classification is tubular proteinuria. Here the tubules are not able to function properly. That is, not able to reabsorb, not able to filter, not able to excrete like that. So low molecular weight protein again present in urine. Because of the excess production, they will be excreted in urine. Here the examples are alpha 1 microglobulin and retinol binding protein, RBP, retinol binding protein. Here the important MCQ is these two are synthesized from liver. Plasma proteins also synthesized from liver. Sometimes they will be asking in MCQ alpha 1 microalbumin retinol binding protein, these two also are synthesized from liver. Here the molecular weight for retinol binding protein is 21,000 kilodalton, whereas microalbumin, that is 30 kilodalton. Okay, so next one is, here the problem is tubules are not able to reabsorb the properly. So tubular mechanism is affected and disturbed. So they will get excreted in the urine, retinol binding protein and alpha 1 microglobulin. This is not microalbumin, alpha 1 microglobulin, right? So this is the last type of tubular proteinuria. And we have one more important clinically significant proteinuria or microalbuminuria. Actually, the level is 30 to 300 milligram per day for microalbuminuria. Usually how they will divide the microalbuminuria is 0 to 30 milligram per day means normoalbuminuria, that is a normal level for albumin. Suppose 30 to 300 means microalbuminuria, that is the earliest sign for the damage of the kidney for the diabetic patients and hypertensive patients. Understand? Hypertensive patient, diabetic patients, they will go for every 6 months or 1 year microalbuminuria test. If their urine is having some amount of microalbumin, that is 30 to 300 milligram per day, means the patient will go for kidney diseases, that is glomerulonephropathy, hypertensive nephropathy, like that. Okay, that is why microalbuminuria is very, very important. 0 to 30 normoalbuminuria, 30 to 300 milligram per day microalbuminuria, more than 300 milligram macroalbuminuria, and more than 1000 milligram call it as proteinuria. What is the significance of microalbuminuria? This is an early indication of nephropathy in diabetic mellitus and hypertensive patients. Okay. Next, we are going to discuss about the last part of the kidney. This is glomerulus. Next one is tubules. So, tubular functions of kidney. Okay.